Thank you for joining us for this week's edition of Southwest Connections, our new campus-based show that introduces you some of the great people that make Southwest the wonderful place that it is. Our guest for today's show is Dr. Laurie Johansen, Director of the Nursing Program here at SMSU. Welcome to the show, Laurie.
Thank you. Hi, Bill.
Tell us a little bit about your personal background and your career here as a nurse.
Personal background, I live in Tyler, Minnesota, born and raised in Tyler, Minnesota. Lived in a 3-mile radius in Tyler, Minnesota my whole life. Married the neighbor boy, and so that community is very important to me. And when I went into nursing, that was one thing that I knew was going to be really valuable. Is you want to take care of people, but when you're taking care of your family, your community, in your small town that you lived in your whole life, it's very impactful. So
tell me about your career as a nurse.
So I became a nurse, aging myself 40 years ago, and worked in Tyler many years. Developed an interest in education and academics, and so eventually I went on and got my master's degree in nursing and started teaching at SDSU across the border initially until this program became available over here, which I was thrilled about because I've always felt like nursing is key to our corner of the state. So.
What did you see as the biggest difference between practicing as a nurse and now being on the educational side?
I had a hard time giving up practicing as a nurse. I've always felt like being a nurse is a real honor to really be that involved in people's lives and the health. It's a real intimate thing with people. And my love in nursing practice was really home care and hospice, and so you really got to live that. When I went on to education, I worried about giving up that practice, and I had a hard time sometimes giving up that practice, but I can feel that practice still there when I interact with my students who are making that difference out there. So you're involved in their practice, which really keeps you involved. So you get the best of both worlds.
That's great. Give us a little bit of the history of the RN to BSN program here at SMSU and kind of how it got started.
So before 2013, there was a president here at SMSU who really had the vision that nursing is very important to our mission and to Southwest Minnesota and the region. And so that was before my time, but he really got a task force going who did some research into is there a need for a nursing program here in Southwest Minnesota, did a needs assessment, and found that we really did need a nursing program, not a standard, we'll teach you how to become a nurse program, but a program that turns a nurse who probably a majority of them have an associate degree, a 2-year degree in nursing. So they're a registered nurse that they got their degree in 2 years and turned that into a bachelor degree. And so they did a needs assessment that came out very strong. And so in 2013, the program started to run as an online program and has grown ever since. And that is a population we continue to help and meet is nurses who primarily have a 2-year degree. They're an RN, they're a registered nurse, just like somebody who has a 4-year degree. But they went down a different path. Many of them, like our partner right down the road, Minnesota West, they graduated from there, and they just come here to continue on and get their bachelor's degree.
How many alumni do we have in the area now?
I just looked last week, 224 alumni.
It's amazing how fast that's grown.
I was surprised by that number. I think that's pretty impressive.
It's pretty neat.
Yeah.
You've mentioned in past, the increasingly rural hospitals are looking for nurses that have a 4-year degree. What's the relevance in that? Why is that so important to those hospitals?
It's a great question. Not just rural hospitals, but all hospitals, all healthcare settings are looking for nurses with more education. The basic premise is the more education you have, the more critical thinking that develops and the better patient outcomes that occur. If you get into the logistics of healthcare, payments for healthcare have changed over the years, and we don't get paid by the day that a person's in the hospital. When I became a nurse 40 years ago, if somebody was in with pneumonia, you got paid X number of dollars a day, and however many days were there, you multiplied it times that, and that's what you got paid. That's not the case anymore. And more we're getting reimbursed for quality. And so they can see that the more education someone has, the better outcomes they have. That leads to that quality. And so it all ties together. And so all facilities are really looking for that higher level of education to get those quality outcomes.
Good. Our RN BSN program, as you mentioned, is delivered primarily online,
Yeah.
and that's made it very popular. Many of our students are working nurses, and so that's very important for them. As an actively employed nurse, how do they find success with our program and balancing it with that online option
Yeah.
at the same time?
I would say that 99% of our students are practicing nurses. Very few are not. There's a few that are, but they are working nurses. They have family lives. One of the things that we have based our program on is creating a flexible program that fits into their lives. So I'll say to people who are looking into our program, you've probably experienced nursing programs where the nursing program was your life and whatever else there was time for had to fit around that. And we try to not structure it that way. Their families are their lives, their professions are their lives. We need to be able to fit into that. So we've made a program that's really flexible. So some people might come to us and take one class at a time, and that's what they can fit, and that's okay. Others might go full-time. Some might come full-time and think they're going to get done in a short period of time, and then they might have a baby or their life changes, and they might slow down and decide that they want to go a little slower pace. So all that flexibility is in their hands. And so it has really helped them fit this into their lives, and that's been a true piece of our success.
Where do our students typically come from?
Southwest Minnesota, but Minnesota in general. More and more we're getting students out of the metropolitan area. Some from the north, a few from surrounding states, Wisconsin, North Dakota, South Dakota, Iowa. But generally, Minnesota is our main population. But it's amazing how they're from all over the state.
You talked about the large number of alums that we've accumulated, and we've seen steady growth here in the nursing program in the last couple of years. Tell us a little bit about the team that you have that works with you in our program here at SMSU.
Well, that is the key to our success. When I came to SMSU back in 2014, I was the only faculty member. We're very small, but I had what we call adjunct faculty helping. So they're like very part-time faculty that are helping. The one faculty member I got to know right away was Dr. Ruth Van Hukelum. Ruth, she goes by, had been part of the task force that helped create this program. And so she has been a faculty member and adjunct with us all these years. She has been key. Just to show you how we're surrounded by success, she has her doctorate of nursing and has been the director of the Midwest nursing program. So she's got a lot of academic experience behind her. And so she's been with us this whole time. Shortly after I came, Dr. Nancy Ruth Leibold joined us. She's got a doctorate in nursing, or a doctorate in education, same as some of the others, and wide areas of expertise. Like she is certified as an advanced holistic nurse, so and that gets woven into our curriculum. So you'll see that area of expertise, and she's just fabulous. We recently added Lindsay Rolick. Lindsay's a local girl from the area who has her master's in nurse education. She's working on her doctorate of nursing through Winona and brings a large area of expertise in public health nursing. Another one, this year we added Dr. Faith Johnson to our full-time faculty. She last year was the interim director for Ridgewater's program. And so we've just got tons of expertise surrounding us. We've got adjuncts as well, administrative staff. We are very blessed. It's
fun to see the growth of that team, and as you said, as we talk in many cases, it's the team that makes the program as successful as it is.
It is.
So how do you go about recruiting new students for the program?
Well, that's more of a challenge. I used to love getting into my car and driving down the road to various community colleges where students were and talking about the program and letting them know how it works and why they would want to do that and answer their questions. COVID impacted that, so I don't get to get in my wheels as often. Right now, I would say that our best recruiters are our students and our alumni. The people who approach us, a lot of times they've been told by one of our current students or by our alumni, come here. And that speaks volumes to our program. It makes me really proud. And so we're doing that. We're doing a lot of online Zoom. Everybody's Zooming, everything. So we do plenty of Zoom meetings with students who are wanting to learn more. But students and alumni are doing our recruiting.
Are the key. So you mentioned it, the pandemic. We're coming up on the 1-year anniversary of things really getting shut down and us having to change the way we do things.
Yep.
What was the first thing you saw to impact your program?
Oh, well, like I said earlier, it's a guess, but I think around 99% of our students are practicing nurses, and nursing practice and healthcare in general, like we all know, changed dramatically last March. And so I was so proud of our students. They were at the front lines, and so some of them were working just an unbearable amount of hours at the time, and then eventually others were furloughed because certain departments in healthcare systems were closing down temporarily. And so I've never seen anything like that in my life. And they are flexible, and they know how to think out of the box. That's their critical thinking that comes through. And so nursing has made this COVID situation what it is and made it bearable for all the people that we serve. And so, and again, our flexible program, we had to step up the flexibility even more. I mean, we just had to be flexible to help meet those. And then some of the students have kids at home, like we've all experienced, and they're trying to manage that while their kids aren't in school, and it's been quite an experience.
I think your program has done a great job because, as you mentioned, these are frontline. These are people who are on the front line, and some of them were right in the middle of it, and then the other end of the spectrum with all of a sudden being unemployed. So, it's really been a challenging year, and kudos to you and your team for working with our students to get them through everything and kind of keep them engaged. So.
Yeah.
I know one of the things that you really had challenges with because of COVID-19 was placing students in clinical settings. How did you go about or how are you going about?
We still are,
with that challenge.
We're still dealing with that. So our students, one of the last courses they take is a clinical course where they spend time with a public health or a community health type nurse. Because when they graduate from our program, they want to be able to register to be a public health nurse in Minnesota. And that's part of the criteria that we follow. So historically, our students have gone to public health agencies, schools, many different ways to get that experience with a public health nurse or a community health nurse. And those shut down. Schools closed, so they didn't need a nurse in school, and many agencies were trying to protect the students and protect their patients that they were serving, so they didn't want any extra people involved than they had. So we had to really think out of the box, and we've been able to develop some virtual experiences for students. We've had a lot of patience with our students. It's been more of a challenge for them to help us find sites near where they live. We don't want them to have to come to Marshall. Like I said, many of them might be in the metropolitan area. We want them to be able to do that near where they live. So we just had to really work hard with students and clinical sites to develop unique opportunities.
There's one thing that COVID-19 has done. It's made people aware of all those things like social distancing, washing their hands, staying away from crowds. But it's also taken its toll on the mental health, and of course, nurses, healthcare professionals, teachers, and even students. It's taken its toll on them. How have you managed that, and what advice would you, as a professional in that area, share with people?
That is, it's just been heart-wrenching, some of the stories that you hear, and I, not being in the front lines, I can imagine some of the stress that our nurses are under. I do know that the suicide rates of nurses is higher than the norm. It's always been higher than the general public, and it's higher yet. It just shows the stress levels that some of the professionals are going through. And so just making students and anybody aware of the mental health services that are available to them, listening to people. One of the things that we pride ourselves on in our program is our advising that we do with our students and getting to know all of our students well. And that has really helped create a resource for our students to feel some support of as well. So challenging times.
I think one thing this pandemic has done is it has hopefully raised an awareness and created a greater appreciation for all our professionals in the healthcare world. And I know your students, as you mentioned, have really had to find ways to adapt and be creative, and you said think outside the box. You have one maybe example you would want to share that you're really proud of on how a student overcame an obstacle and adapted?
Clinicals. You asked about clinicals, and that can be a challenge. So we had a student who worked with the school nurse and created videos. So all of the clinical experience was primarily from home, but created videos with that school nurse to be able to show to the students, teaching them about COVID and hand washing and various topics. And he shared the videos with us when we were done. They were so high quality, and I was so proud of him. And so we've never had students create videos before for that type of setting, and it worked great. So
that's fun to hear. And as you said, critical thinking skills are one of the things that our program really helps develop.
Yep.
And that's, I think, another example of how you have to be creative and come up with ways to adapt. So,
yeah.
Laurie, I know recruiting has been a challenge, and you mentioned the key players really are our alumni and our current students. Anything else that you've been doing on the recruiting front to try and get in front of students throughout this past year?
We have a new face in our department. Stella Wachiku is her name, and Stella has become the face of our program, so to speak. We wanted to create an opportunity for students to consistently be able to connect with somebody while they're learning about the program, getting into the program, applying, helping them through those initial stressful phases of learning how to get back into academia. And so Stella gets to know every student who shows some interest here and gets started. And so she has done a fabulous job and has become that face of the program. And so I think when you get to know any of our new students and you say the word Stella, they smile and they know that that's been a huge resource that's been helpful to them. So that's been a great addition.
Laurie, if anyone's interested in learning more about the RN to BSN program here at SMSU, how can they go about getting a hold of you or Stella for that matter?
Yep. Go to our website, www.smsu.edu. We'll take you to academics and nursing. Got a beautiful website there that gives you some contact information about the program itself. We would gladly meet with people via Zoom or phone. We reply to emails very timely. People get attention when they show some interest in our program, and so they just have to reach out.
Very good. One last question for you. If you could tell a prospective student and their family why SMSU is the place for them, what would it be?
Well, if you put everything together that I've tried to describe, the flexibility, and I really didn't get to get into our courses even and how valuable they are. I think it all comes down to we are very student-centered, and we want to create an inclusive environment that people feel comfortable in and learn and grow in. And so it's that student-centered approach that I think is key.
Very good. Thank you, Laurie.
Thank you.
Well, coming up next week, it's hard to believe, but it's already spring break. So there will be a limited number of activities on campus, but most people will be away for break. So I encourage you to keep up with our latest news and events. Be sure to check out our website at smsu.edu. Once again, thank you to Dr. Laurie Johansen for joining us today. Tune in again in 2 weeks when Dan Kaiser, Professor of Computer Science, will be our guest here on Southwest Connections. Thanks for watching.